There is no one test that can be used to diagnose mild to moderate Alzheimer's disease. To first rule out other possible causes of memory loss, including the forgetfulness that may occur with old age, I may perform a series of tests to help identify whether other diseases or issues may be causing the symptoms of dementia, like diabetes, kidney or liver disease, or side effects of medication. For example, these tests may include a complete physical exam, urine and/or blood samples. I may also perform memory or psychological tests to see how well the brain is working and to rule out other brain disorders that may be causing your loved one's symptoms. A brain scan, such as a computerized tomography or CT scan, will show shrinkage and lesions or areas of damaged tissue in the brain of people with mild to moderate Alzheimer's disease. Not all patients require these tests, and they may only be performed if doctors think additional testing is necessary. We don't yet know whether these lesions cause the nerve cell damage or result from it, but the presence of loss of brain mass may be a strong indicator of disease. In fact, the term Alzheimer's disease dates back to 1906, when Dr. Lois Alzheimer discovered these lesions in an autopsy of the brain of a woman suffering from the symptoms that we now associate with this medical illness. Another factor that makes mild to moderate Alzheimer's disease difficult to diagnose is that the causes of the disease are still unknown. It may be triggered by many factors, the most common of which is age. But it may also be influenced by genetics. Research has shown that the presence of certain hereditary genes may boost a person's susceptibility to the disease. Overproduction of harmful substances in the brain, serious head injuries, and lifestyle factors. Evidence is increasing regarding the influence of health habits on the development of mild to moderate Alzheimer's. Smoking, lack of exercise, poor eating habits, and a lack of social interaction have all been shown to affect a person's risk for the disease. There is no cure for Alzheimer's disease at this time. However, there are a number of medications available, either alone or in combination, that seek to help with symptoms of the disease. You will learn more about one of these medications and how it works in later chapters of this program. The current research suggests that the best treatment plan for mild to moderate Alzheimer's disease involves both medication and non-pharmacologic behavioral therapy. This may include counseling, adult educational activities, and art or music therapy. Activities like these can provide your loved one with an outlet for expression when ordinary communication becomes more difficult. By encouraging these activities and helping your loved one to attend and take part in them, you're playing a vital role in their treatment. But remember that it's just as important for you to have the support you need to maintain your energy and deal with any emotional difficulties that can occur as you help your loved one live with this disease. In a later chapter, you'll hear from another caregiver like you who has some suggestions for coping.